Yoga can be dangerous if done incorrectly. And there are a lot of people out there who don't want to talk about this. Everybody only wants to talk about the health benefits of yoga. Yoga is great. Yoga is fantastic. Everybody should be doing yoga. As a yogi for 20 years and a yoga teacher for 15 years, I agree completely. But as a sports and spine doctor who's treated many yoga students in New York and now in Dubai for the past 3 months, I say take caution. There are a lot of people out there who need to take caution when practicing yoga. And there's a subgroup of people who are at risk of injury more than the general population. The question is, why does this happen? What can you do about it to prevent injuries? Yoga is generally a safe, low impact activity that nobody should be getting hurt with. But there are reasons why people keep getting hurt with. Number one, inadequate instruction or supervision. A lot of people are doing poses incorrectly. So you're in a class, you have a ton of students in the class, 30 students in the class. There's no way that your teacher could pay attention to you with that many students in the class. So you have to make sure you're going to a class that has a much smaller proportion of student to teacher ratio. You also have to make sure that you're doing the poses correctly. Otherwise, if you have an incorrect alignment, if you're not doing the pose correctly, you're putting your body at risk and you could get injured. Number two is pushing your body beyond the limit. Everybody wants to do a headstand. When I was 21 years old in Mysore, India, there's nothing else I wanted in life than to do a headstand. I didn't care about getting married someday. I didn't care about becoming a doctor someday. All I wanted was to do a headstand. And this is still the same thing I heard when I was a yoga teacher, and I've seen so many people getting themselves injured doing a headstand. The reality is it takes a very long time to prepare your body for a headstand. The reality is your neck is not designed to support so much weight. Unless you're a lineman, unless you're a rugby player, or unless you've been practicing yoga and preparing for the headstand for a long time, it's going to take some time for you to prepare for a headstand. And you have to be very cautious. Yoga encourages individuals to challenge themselves, but pushing yourself too hard or attempting advanced poses without proper preparation can result in injuries. And that's why it's so important to listen to your body, respect your limitations, and progress gradually. Number three is lack of awareness or mindfulness. Yoga means union. It's a union of mind, body, and breath. Yoga is a spiritual practice and not just another form of gymnastics. When you fail to understand that, you fail to get any benefits of the practice. You put yourself at risk of injury because you're not moving with purpose. And so you have to be mindful when you're doing yoga. Another common one that I used to see all the time when I taught was competitive mindfulness, comparing yourself to the people around you. And so rather than my students being in class and just breathing into their poses, they'd be looking around, oh, who's that cute girl over there? Who's that hot guy over there? Oh, what are they doing? You have to stay in the zone, focusing on yourself. not pushing yourself too hard to achieve a particular pose. Yoga is all about self-awareness, self-acceptance. So it's important to avoid competitive mindset and focus on your own progress, because the reality is everybody progresses at a completely different pace. And finally, the biggest factor for injury, in my opinion, is joint hypermobility syndrome. About 10 to 15% of the general population have this syndrome. And I've made a video previously, about 5 years ago, about this syndrome. It's very interesting. And a lot of people are not familiar that they even have this, because they don't have any symptoms and will never have any symptoms of this disorder. The way that it presents is that they're just simply overly flexible. And so they were born and they find themselves that maybe when they were younger, maybe when they were teenagers, they were very good at gymnastics and sports because they were extra bendy, extra flexible. And there's a number of tests to test for that. And so when they end up being in yoga class, they're just able to bend further than an average person in class. And what this syndrome is basically, it's a connective tissue disorder. And what it is connective tissue. What it describes is things like ligaments connecting bones together. And then you think of these ligaments like little rubber bands that hold things in place. And these rubber bands, like your scrunchie, could become lax or lose its elasticity, its ability to bounce back together. And when it does so, you are at risk for injury. You are at risk of overstretching that joint, whether it's low back, whether it's hip, whether it's shoulder. And so this population, when they're in a yoga class, they push themselves and they're unable to sense the fact that pushing themselves more than they should. And so on the one hand, they're able to do poses better than an average person, but on the other hand, they should not be doing that pose because they're actually hurting their joints. And as a result of that, when they're maybe in their 20s, in their early 20s, that's perfectly fine. But when they get into their 30s, 40s, 50s, that's when they begin to manifest their problems. And so this is when I begin to see them in my office, when an orthopedist begins to see them in their office, and when they begin to develop arthritis, early onset arthritis, which is, you're not supposed to develop that in your 40s. You're supposed to develop it in your 60s, in your 70s. And so that's your joint hypermobility syndrome. Another very common question, a question that I very often get asked by a lot of my patients is there a best yoga that I should practice? And the answer to that is not. Anything that really gets you off your butt and exercising is really what you should be doing. There are, however, types of yogas that put you at risk of injury more than others. So for example, Bikram yoga or hot yoga, when you're in a hot environment, that heats up the temperature of, again, these ligaments. And when these ligaments or tendons are at a hot temperature, you're once again able to push yourself further than you're able to sense. And when you do that, you're also putting your body at risk of injury. And so you should be extra cautious when you are in a heated environment. So my general rules to avoid injuries are: go to classes where you have a qualified and an experienced instructor. Don't go to classes where you have a high student to instructor ratio, so nothing greater than 15:1 students to teacher. Make sure you tell your teacher that if you have any pre-existing injuries or health conditions, listen to your body and don't push yourself beyond your limits. Gradually progress and build strength and flexibility. Make sure you practice proper alignment and technique. Take breaks and rest when needed, and incorporate warm up and cool down techniques. Thank you so much for your attention. Press like and subscribe.